and I'm going to fade away into the background. Message me or let me know if you need anything else from me.
All right. Good morning, everyone. This is the Great Lakes ROTA-RC presentation on rural information hubs. Welcome in this morning. Today's session is being hosted by Great Lakes ROTA-RC's regional partner, UW-Madison Division of Extension. So I just want to thank them for sponsoring our speaker today. My name is Amanda Cura. I'll be your host for today's session. Before we get into our presentation, we have a few quick housekeeping items to address. Jen, is there something you wanted to?
The screen says rollout forgiveness.
Oh, I am sorry.
Maybe we could just skip to the next screen.
Yeah, we're gonna go ahead and do that. And we'll get that corrected. That's my apologies. One of the first things that we need to do is acknowledge our funder. And as a result of our funding activity, we are a Great Lakes ROTA-RC. We are funded by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. We are a Health and Human Services Region 5, which covers Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. As part of our activities, we provide virtual and/or on-demand education, evidence-based resources and research, as well as technical outreach to professionals working in and with rural communities. I want to just take a moment to highlight one of the sites on our website, or one of the pages on our website. Our resource library has a plethora of resources on it that we encourage you to go ahead and check out, as well as our events page. The resource library has community toolkits, community resources, videos, podcasts, supportive apps. We're updating the resource library all the time. We'll be doing some overhaul on our website in the new year. So you might see a few visual changes, but all of the resources themselves will stay the same and will continue to update and advance. So please feel free to check it out. I'm going to have Jen or Christina go ahead and put Jen, if you could put the website in the chat for me, that would be great. Let's move now into our session and preparing ourselves to listen and engage in the session content. Before we begin, we want to take a moment to promote the use of affirming person-first language when discussing behavioral health disorders. As we create that environment of learning, together we want to feel welcoming and safe for everyone. And so let us work together to manage a space that supports us in creating that non-stigmatizing, recovery-orientated language that can help reduce negative bias and promote engagement. As always, we invite you all to learn about successful prevention, treatment, and recovery from whatever space you are joining us from today. And we welcome you formally into the Great Lakes ROTA-RC community of learning. I want to welcome you now our presenter for today, Erin Kunz, Information Specialist for RHIhub. She's an information specialist with the Rural Health Information Hub, and she focuses on indexing and writing about rural health resources, organizations, and data related to the Region C states and topics such as chronic disease, health disparities, healthcare access, schools, social determinants of health, human services in rural areas, maternal health, and more. In this presentation, she will discuss how to best utilize the Rural Health Information website to support work in rural health. I'm going to hand it over now to Erin as our presenter for today.
Thank you so much for that introduction. All right, so I've shared my screen, which is the RHIhub homepage. So this is where I'm going to do most of the presentation. So as Amanda nicely said, my name is Erin. I'm an information specialist at the Rural Health Information Hub, also known as RHIhub. And so what we are is a federally funded clearinghouse for rural health issues, data, funding opportunities, and more. So we house a lot of information that is helpful to policymakers, healthcare providers, anyone, human services providers, community organizations, folks like yourselves, people doing work in rural areas. So if you need resources, data, visualizations, models, toolkits that are related to the work that you're doing, you can find that on the Rural Health Information Hub. And I'm going to go through some specific things from our library to highlight how we can be helpful to you. And so I want to point out right away before I get into anything, on the top here, we have updates and alerts and a contact us button. And so with both of these, you can tailor the information that you need by getting our weekly newsletter, or you can get, that's just what's been indexed in the last week. So the most recent information, the most recent organizations, funding opportunities, resources, news items, things like that, you will get every Wednesday. Or you can also do the daily and weekly custom alerts. So if there's a specific topic that you want information on, so if you want a notification anytime we index anything about opioid use, you could click that topic. And anytime we index anything about that, you will get a notification. So that can be really helpful. You can also do that with geographic regions as well. And then next, I also want to point out our contact us page. I'll start and end here. So if nothing else, we do have an information line that is staffed 8 to 5 all week long. And because we're federally funded and meant to serve rural stakeholders and offices of rural health, we are essentially a free service to you to answer your questions. So we will, if you are looking for a rural health fact or information on an issue or funding opportunities and you feel like you're coming up short, please email us and we will do that work on your behalf. So for example, if you are looking to open up a clinic and you want information on what funding opportunities might be available in your area, you can email us and we will do that funding search for you. If you are looking for a piece of data you just can't get your hands on, you need a specific information about a county and you can't find that data, we will do that search for you. And if we can't find it, we'll of course let you know, but we can be very helpful to you in that way in doing that research portion that, as we know, a lot of folks working in rural health probably do not have time to do because they're wearing so many different hats. So we are happy to do that work. All right. There should be time at the end for questions, but feel free also to unmute if you want me to kind of pause on an item, or if you want to ask a follow-up question, just interrupt me, that's totally fine. But I'm going to start here at the online library. So here is where you'll find our more library-like information. So anything that we have indexed on funding and opportunities, news, events, organizations, or resources. So for example, if I go to funding, it'll give you a little bit of information on how to search that, that part of the library. So you can look for funding by type, sponsor, topic, or state. I typically am looking at these two the most for folks, the topic or the state. There are times when people are looking specifically for like rural loan reimbursement, for example. So I might look at type there, but typically I'm right here. So if I'm going to look at topic, this is our taxonomy. So you'll see this a couple times in the presentation today, how we index different things. And I should point out that we do, for the purposes of this group, we do have a taxonomy term for opioids, but we also have a taxonomy term for substance use and misuse. And either of those are going to be good starting places for you if you're looking for information. So I'm going to click this one, and this is going to show by date what has come out in terms of funding on this topic. So the first one, it says the application deadline is tomorrow. So if you're interested, get started, leave this webinar immediately and get started. Reaching Rural, Advancing Collaborative Solutions, a one-year training and technical assistance initiative designed to help public safety and public health practitioners and other community stakeholders collaborate more effectively to address substance use and misuse in rural areas. And we'll always have this information in the short description, which is the geographic coverage, the deadline, and the sponsors. So if I go down to one that has a deadline a little bit further out, so this one's January 4th, and then there's some that will have rolling deadlines, and we will mention that too if it's a rolling deadline. So let's do this AmeriCorps one. You can click into that, and towards the top, we will also have the contact information. So though we index funding opportunities, we are ourselves not funders. So we are indexing what other organizations are putting out there. So a lot of times we are making that clarification because people will contact us, and we can give you a limited amount of information about the funder that we have on our website, for example. So this, once you click in, you'll get a more extensive look at what the application process is, the amount of funding, what type of things have been funded in the past. But if you really want to know if it's a good fit for you, you want to contact that funder directly. Okay, so the next thing is just news stories. These are not permanent in our online library, so these cycle out every 60 days. But you can find these by searching in the same way, and they also come out in our weekly newsletter too. The calendar of events. So if you are looking for a specific rural health event, this is a great place to go. Although we have pared back a little bit because there are so many online events now. There's just almost a constant amount, even rural focused, of online events that we mostly focus on in-person events, unless it's, you know, specifically rural health and RHIhub focused, we will index it, or if it's like a nationwide funder, so if it comes from CDC or HRSA or FORP, we might index it, but typically we're talking about in-person rural health events. So that you can also look at this taxonomy here and see any of these items that you might be interested in. So behavioral health, for example, if I click here, you will see upcoming events. And actually, you'll see our event right on top. We are tagged right here. And then organizations are listed here. Another way to get organizations is through topic and state guides, which I actually think is a little bit more helpful. So I will give you an example of that. And then finally, resources. This is another very popular search for people coming on our site, is that they're looking for a specific type of information. And this is true across the board, whether it's a policymaker, a human services provider, a healthcare provider, students. We have a lot of people going through our online resource library because we have thousands and thousands of rural health focused resources. So if you want to research, say, by topic, and so you're interested in the behavioral health workforce, you can also narrow this even more by the type. So we have podcasts, videos, charts, maps, documents, by geography, or further by topic. So let's say in this case, we want to narrow it to see anything about the behavioral health workforce in Wisconsin. So you'll see we have 7 resources that focus on Wisconsin and behavioral health, and then always rural too, because we are the Rural Health Information Hub. So we're indexing information that comes from that perspective. So the most recent one we have is the state perspective on rural behavioral health crisis services. And so if you click into this, the view details button will give you a little bit more, a library-like description. So this is a lot of what my day looks like, is finding these resources and writing up the descriptions. And then you can go directly to the actual information document, podcast, video, whatever it might be. And because we are federally funded and meant to be available for everyone. Our things are 99% of the time free. We do not index things that cost money to access or are behind a paywall. So most of the time, if we have it on our site, it's free access to you. Okay, so I'm going to move on to topic guides and state guides. So our online library, you can access anything on our site. As we get to the right side of this search bar, it's going to start organizing some of the same information, but in just a slightly different way. So if you look at our topic guides, this is another thing that information specialists like myself do, is that we write and update these topic guides. So we have lots of different types of topic guides, but they're a more academic look at a specific issue in rural health, rural human services, things like that. So they are organized here if you're interested in rural healthcare delivery, rural healthcare workforce, specific populations. You can find that information here, rural population health. So social determinants of health for rural people, for example, is one of the topic guides that I update. And also you will see that we do have current and critical issues. So these are always changing and filtering in and out. But we do currently have topic guides on COVID-19, rural response to the opioid crisis, and rural response to farmer mental health and suicide prevention. I'm going to show you our opioid toolkit a little bit later. So actually for the topic guide, I want to go to substance use and misuse. That will show you some information that also includes opioids as well. So if you just look at this page, you will see that you can also go to charts, resources, organizations, funding opportunities, news events, models, and innovations that are related to this topic. So in some ways, it's like a filter as well. Anything that you click within here is going to be about substance use. If we go down a little bit, you'll see that there's an intro to this topic. So again, kind of like a more academic essay-like intro to these issues. It'll list any toolkits that are relevant. And then it will go to frequently asked questions. So this is really how all our topic guides are organized, is by some of the pressing questions. And then we will list information that tries to answer that question. So if I go here, what is opioid misuse and what effect has it had in rural communities? So we have information in a narrative format, but you'll see that you can click on the resources that are pertinent to answering this. So according to a 2021 report from the USDA Economic Research Service, the rates of overdose deaths from synthetic opioids such as fentanyl and so on, giving you information, and then you can click these resources and go directly there. So it's helpful if you're looking for information that's already been summarized and presented in a nice way for you, that's easy to understand. But then if you are interested ever in the original resource and the raw data, we will always have that link too. So if you don't want the information summarized by RHIhub and you want to go to the original source, you're always able to do that. Okay, so I'm going to go back to the top and also give you an example of an item that's in all of our topic guides, which is this chart gallery. So this is going to show you visual data that's relevant to the topic. So let's go to this one. It shows age-adjusted opioid overdoses for metro and non-metro counties. So if you can see this light blue, this higher one is showing metro. And then non-metro is this darker line here. And so you can get that data. And if you go here, you can save the image. And we do definitely let people know that they can use RHIhub in their presentations. Professors use them in their PowerPoints. All we ask for is attribution, but otherwise we are happy to have you use the information. So you can share that information and then you can actually save the data as well. And with any of these pieces of data, we will list the source. So if you want to go to the data source, in this case, it's CDC Wonder, you can go there. Okay, so I'm going to move on from this and give you an example of the state guides. So along with certain topics, we keep information on all US states, territories, and Commonwealth. And these get updated regularly as well. A lot of times they get updated in batches because if new data comes out that's relevant to all states have to get updated at once. You can also go to state by state resources to see how states compare. For this section, I'm actually going to just focus on one in your region. So let's go to Minnesota. This is also one of the states that I update. Everything in this Great Lakes region are states that I update. So if you ever, as you're looking through this, if you're thinking, oh, I wish RHIhub had this resource or posted this event, or really that funding opportunity is real focused, it should be in the library. You can also email me directly. So that's another thing that we do as info specialists is we put out the information, but as we network and meet more people in our rural health networks, if you have things that you want to be available on RHIhub, please email me and I'm happy to get those up there so they get a little bit more visibility. You can, and if you forget my name, that's okay. You can always contact the info line and whoever is doing the info line that day will get that up for you as well. So on all of our state pages, we have the same format, which is that we first list the State Office of Rural Health. That's who we serve. So we give that information right away. We show the estimated population and folks living in non-metro areas. A lot of our information, when I say rural too, is we have county level information. So you'll see a lot of resources that are broken down by the county level. The rural health facilities in Minnesota, and then a just very brief paragraph on the social determinants of health. So in this case, access to insurance, the poverty rate, education levels, information like that. But just like the topic guides, we have a chart gallery, resources, organizations, funding and opportunities, news, events, models, and innovations, anything connected now to Minnesota. But all of these things are also cross-indexed. So for example, if we go to events, Know Your Resources Rural Health Information Hub, this event is listed here as well. So you saw it in the behavioral health topic, but because it's also focused on Minnesota, you'll see it here. So we try to cross-tag everything so people can find what they need. I also want to point out the chart gallery because this can give you some pretty useful information and visuals. So for example, if I go here, and this is standard across all states. So you can look at this across all states. This will show you 18 to 24-year-olds without a high school diploma. So I can go over these different counties and see their exact percentages. And then we also have, of course, our source listed. So this comes from the census from 2010, 2016, and 2021, the 5-year estimates. And then we have the counties listed. And so you can access this information too through the Rural Data Explorer, but because it's indexed in multiple ways, I can also click back to US, and this is going to give me a national look at the same data. So here, same thing, 18 to 24-year-olds without a high school diploma, and it's a county level national look. All right, I'm going to move on to rural data and visualizations unless anyone has questions, or you can keep them for the end, that's totally fine. If you want to think about any of the rural health projects that you're doing at the time as I'm talking, well, I'm looking for this piece of data, or I really need a funding opportunity on this. Are there any resources on this issue? Please be thinking about those, and you can ask me when I'm done talking, or you can send me an email later too, and I can take a look for you. So I'm gonna head to the rural data visualizations. This is a pretty popular item on our website. It has our Rural Data Explorer, our chart galleries. So this lists all the charts. So for the topics, the states, everything, as well as our maps. So I'm going to start with our Rural Data Explorer. And so again, this is cross-referenced throughout our site. So we can go back to states, we can go back to specific issues. And there's lots of different ways to look at this information. And we will always list where our data is coming from. So we are not a research center. So everything that we are putting on our site, we try to make it as organized as possible for you, but the actual raw data is coming from somewhere else. So we will always cite that where that's coming from. All right. So we have all these indicators that you can look at with our Rural Data Explorer. So demographic information, health disparities, health workforce, healthcare access, social determinants, tribal health, and information about veterans. So those are the different indicators you can explore on. So I'll give you an example of how this can be really helpful. So say the scenario is you're trying to talk and collaborate with a policymaker. So you want to show how poverty is potentially related to substance use. So I have my indicator on poverty. We can go to, let's do Wisconsin and look at poverty on a county level. So you'll see down here, the darker is more poverty. So you can put your cursor over to see the information. And just as a reminder, you can share all this, save it, and save the data too. So let's look at this one. So Milwaukee County in Wisconsin has a 17.8% poverty rating. And that's according to the US Census Small Area Income and Poverty Estimates from 2009 to 2021. Whenever we get new data, we update all this information. Okay, so we have that in mind. Now we can also look at a different indicator. So let's do overdose deaths per 100,000. Again, you will see the darker levels is higher by county. So I'm probably not sharing anything that's that shocking to this audience. But if you scroll over Milwaukee County, you will see that it has one of the highest overdose rates in the state. And so that would be a way to easily visualize a lot of the issues that rural health providers, stakeholders, community organizations, state organizations, national organizations, technical assistance centers are trying to make known, to show with data, with visualization, oftentimes to policymakers. And so this is a good way to do that. As I mentioned, we have our chart gallery here. I've gone over this, so I'll skip over it, but topic, state, and type, you can look at the different charts we have and also the different maps. So I will just click into healthcare facilities. We haven't really talked about that. If you're interested in the rural health clinics and where they are in the United States, those are the types of maps that we have. Of course, you saw some of the other demographic maps and things like that already. But if you are looking for, again, the visuals can be so helpful when you're telling a story. Here's the poverty map again. This is population and poverty by county. Non-metro is the green, metro is the blue purplish colors. All right, so let's move on to our last two items. So we're getting close to the end here. Case studies and conversations. So here you will see where we have listed RHIhub, a lot of original material from us. So where we have put together rural health models and innovations, our Rural Monitor is a series of journalism. So our web writers go out and find folks who are doing interesting things in rural, interview them and write their stories. So that's what you'll see at the Rural Monitor. Same with the Exploring Rural Health podcast. This is relatively new. But we have a graphic designer and a podcaster who interviews folks in rural health. And actually, I'm going to click on that one because the latest one, I just listened to it, was really great. Keeping Rural EMS Reliable and Sustainable with James Small. So that's actually out of the Wisconsin Office of Rural Health. So that's great timing. That was the last one we just did. So that's a really great resource as well. We have webinars that we do, videos that we do, and then rural health philanthropy. So if I just click on Rural Monitor, you'll see some of our latest stories. And if you ever have ideas for these too, we often will hear from our offices of rural health, but we take ideas from everyone. So there's lots of different types of organization that's doing work in rural areas. And we love to hear about that and either write up a model, maybe interview for the podcast, things like that. Rural health and innovations. So this is where you're going to find examples of how rural communities are addressing issues. And so this can be really helpful for people who are trying to solve a problem. So if we browse by topic and say, we're thinking about substance use and misuse, and we want to see different evidence-based models that rural communities have done, you can find it in our models and innovations section. So in this case, the Helping Kids Prosper. It's an approach to support sustained quality delivery of evidence-based programs for youth and families in rural communities. And then we'll say what they actually did and what the results were. So the data showed us that the youth in Prosper communities reported delayed initiation of a variety of substances, lower levels of behavioral problems, and improvements in family functioning and other life skills. And then I can click into this. You'll see more information and relevant videos, links, challenges, replication information, all the way down to the end. So these are very popular and can be helpful for rural communities who are looking for specific models. Our tools for success. So here we have our MI Rural tool, which is pretty heavily used, evidence-based toolkits, FORP-funded programs, economic impact analysis tool, and others. I'm actually going to just focus on two for today, and that's the MI Rural tool. So we get this question a lot too, because we just had a webinar actually on this, rural definitions. Am I rural? Literally, am I rural? What counts? And so we have a tool that looks this up for you. So I have already inputted this, the extension office in Wisconsin, to see how rural you are. So let's run the report. So just general information about where you're located, and then it will show you different common rural definitions. So you know, frontier and remote area, this is a newer definition, but it will say if you're located in that. In this case, it says no, but your RUCA code is 4, so that is considered a micropolitan area. And then what people often really want to know is their program eligibility. So that's why people want to know if they're considered rural typically. So are they rural in consideration of FORP funding? Yes. Are you rural for CMS? Yes. For shortage designation. So another thing that this tool will show you is your health professional shortage areas. So primary care, dental care, mental health, all the way yes. So your location is a shortage area in all of these cases. But interestingly, it's not considered a medically underserved area or population. So these are other terms that define shortage areas and rurality to some extent. There's overlap, they're different. You can be underserved without being rural, but they often do go together. But in this case, the definitions all say no. So this can be really helpful to run if people are trying to figure out what their clinic might be eligible for, what their organization might be eligible for based on their geography. So this is the last item I'm going to show you is our toolkits. Just like models and innovations, the toolkits are really helpful for how to actually implement best practices, implement programs in your area. So I will slowly scroll through so you can see the different toolkits. This is one of our newer ones, Emergency Preparedness and Response Toolkit. Of course, with COVID-19, this became a more pressing need. So we do try to respond to that as well. What are people needing in their communities, and how to respond to emergencies was something that was really pressing. So let's go to this one. So Medication for Opioid Use Disorder Toolkit. So when you click into one of these toolkits, you'll see the overall summary of what you'll get, and they're all structured the same way. So every toolkit has an intro to the topic, program models, a program clearinghouse, so examples of programs related to the topic, how to implement, how to evaluate, and then different options for funding and sustainability, and then dissemination. So if we go to program models on this one, you'll see different examples for systems of care, providing psychosocial services, improving access. In the program clearinghouse, this is where you're going to see those actual examples. So if we go to Horizon Health, for example, the location was Corbin, Kentucky. Kyle Perkins, the executive director, was the person interviewed. And then it will give you examples of exactly what they did. And then, as I mentioned before, we try to cross-index everything. So models represented by this program, while they did co-location of services, it's telehealth, and it's a model for providing psychosocial services. So you can always go back to those topics and find everything that's listed under those specific topics. Then implementation. So organizational readiness, workforce consideration, addressing stigma. So if we go through that, it gives kind of that same topic guide type narrative, also with resources. How to evaluate. Different funding and sustainability options. So if I click funding sources, it'll list some grants and funding opportunities, which often kicks you back to our funding library. So you can start there too. And then dissemination. And then our About toolkit lets you know who it was developed with. In this case, it was developed with the North Walsh Center for Rural Health Analysis. And then our contact information if you have any questions or comments about the toolkits. And so I didn't go through every single one. We went through a lot though. But remember, I will end here again with the contact us. That if you have any questions, if you're looking for something, you can always contact us and we can do that research for you. And that doesn't just include things on RHIhub. So sometimes, especially for funding requests, if someone is looking for funding to, create a clinic that's going to address substance use, we will look certainly on what's on RHIhub, but a lot of times we look in a separate funding library that might show potential funders that aren't rural specific, but could still be helpful to you in the project that you're trying to do. So any question that you have, that's what we're here for. That's why we're funded. So please feel free to contact us. So I'm going to go ahead and go on mute, and I will stop sharing my screen. And if anyone has questions, please feel free to jump in.
Erin, I wanted to make sure you had the opportunity to see the one question about any visuals earlier that or after 2018 that one person asked. Would be adequately get to address that.
Sure, yeah, so in our chart gallery and our data explorer, we have multiple sources. So you know, since we have so many different indicators, poverty, healthcare workforce, information like that, it gets pulled from all different types of data pools. So we have the most recent version of that data. So once the research center, or at times, you know, the census or whatever, whoever is producing that data, once they update their data, we will update that as well. So we have what's most recent, what's out there. In some cases, that will be hopefully this year, because that's always what's most helpful, but you'll also see indicators where things can be older if things haven't been updated since 2016 or 2018. And that's just a representation of what's out there currently.
Please feel free to unmute and ask questions or type it in the chat and I'll be happy to support your question.
I should also mention too, with that data question is in our data explorer tool and our maps, we pull from, you know, national data sets. So whatever is available across all states. But that doesn't mean that, like, Wisconsin, for example, doesn't have more poverty data that's just specific to Wisconsin. So if you're ever looking at something in our chart gallery or our data explorer and you're hoping that there's something, you know, more recent than 2018 and you're looking for just your state or just your county, there is a good chance that there is a resource available that's going to give you more recent information. It's just a different data source than what we have on our data explorer tool. So you can always email us and we can do that search for you too.
All right, well, while people are thinking of their questions, we're going to go ahead and tie up a few end of presentation activities. The first one is if you logged in with us today on a link that was shared versus the registration form, that's 100% okay. We're happy that you're here regardless of how you came here. We want to make sure that you get connected with us formally. So please feel free to send us your name and your address to the Great Lakes ROTA email. That helps us to make sure that we get you access to our website, our newsletters, so that you can get more great training like the one Erin provided us today. Lets us keep you up abreast of what's coming up next. We've got a lot of great things coming up in the new year. It also helps us give you your certificate of attendance for today. So please reach out and send that information to us. We're going to pop our email, our website, and our technical assistance outreach. So if you've got something going on in your coalition, your community right now that you'd like to help, you like some help problem solving that, or just some connection to some resources, either in your state, across the region, reach out to us for a technical assistance request. We're more than happy to be the bridge, that campus community connection, that community connection. Let us know what you need help with. We're more than happy to be there. So we'll pop those connections into the chat here in a minute. And we thank you again for connecting with us today. We do have just a quick survey that we'd like to send you. So we'll place this link in the chat, but if you'd like, just pop your phone up to that QR code. Let us know how you're doing, how you found the training today. It also helps us give Erin some feedback on how helpful you found this information, so that RHIhub can continue to develop their resources and their outreach. They're one of our valuable partners. So we want to keep those connections good. And if this is helpful to continue to do a presentation like this again in the future, we would be more than than happy to do that. So keep letting us know what you need as a professional partner. We'd like to continue to provide your professional development needs. So just take a few minutes to do that, and we're very grateful to you. The last thing that we would like to do is let you know what's coming up. Like I said, we're going to be pretty busy, and we'd like to see you there. So on Monday, January 8th, we have harm reduction public health vending machines. Get registered. That one is wildly popular. Want to learn about what's happening with public health vending machines? Well, our partners at University of Minnesota would like to tell you. So please get registered for that event. You can find out more on our website. And then later in the month, on January 23rd and 24th, we have early warning signs and suicide prevention best practices with children and youth coming. It's a 2-day event, and it will be 12 to noon on both days. So make sure you get registered for that as well. So we look forward to seeing you at future events. If you've got more questions for Erin, please feel free to stay on, and we'd be happy to support your questions. If not, we look forward to hearing more about or seeing more of you in the future. And you're welcome to go when you're ready. And we will get those links in the chat for you.
There is a question from Jeremy Suttles. If we were to make a data request, would staff be available to meet with us to help us show us visually how to find data for future searches?
Yeah, great question. Yes, definitely. So I keep saying email since I live on email, but we're also available by phone. So there is a phone number that you can call us and we can have a conversation, but we can also meet with you. So whatever it is that you're needing, we can certainly do that.
Should we stop recording?
Yes, please.
Christina, can you stop recording?